Hi everyone, welcome to my YouTube channel and today's talk, tips to help you choose your first post as a newly registered nurse, which is something I'm asked about on a regular basis by near to registering students. And if that's one of you, well done for getting there. You're nearly there now. I've also, do check out my other videos. I've got one on post-registration education coming up and what to expect. And if you're going to be applying for jobs, I've got a video on how to prepare and structure a personal statement and prepare for Band 5 interviews. So you might find them helpful as well. So today I'm going to go through some tips to help you choose your first role, how to use informal visits so you don't leave it all to chance, what to expect in your first role, and where and when to apply. Why is your first post so important? The transition from student to newly registered nurse, I don't need to tell you all, is challenging and overwhelming, and the evidence base would show that on newly registered nurse experiences. And you really need a good standard of clinical education, preceptorship and manager support to thrive. So you mustn't leave your first post just to chance. You develop confidence and key transferable skills during that first year registered. So you need to feel happy with the team that you're working in, and life is too short to spend 8 to 12 hours unhappy. So make sure that you do as much research as possible before you start applying for posts. There is so much choice out there at the moment, and one way of starting to think about your first post is to review past placement feedback. Think about what type of nursing, what specialist areas did you enjoy, what were your strengths, what did your practice supervisors say in certain areas and fields. Have you developed a passion for an area, and do you want to try something new? I know students that never experienced oncology, for example, that were thinking about doing it, and I would say, encourage them to have a go at doing oncology, because you'll gain key transferable skills to do with palliative care, end of life care, that you can take anywhere throughout your career. Information giving and a person-centered approach. So it's, that first 2 or 3 years when you first register is about consolidating your learning, and you'll take those skills with you for the rest of your career. The second thing to do is to have a look at what's out there and what's available for you to apply for. And you might be quite surprised, because some posts won't, they might say a healthcare professional, a registered healthcare professional. So you might find a post that's to do with health promotion, for example, and that you didn't think you'd ever go for. I know people that have gone for posts that they didn't think that would be there when they were looking. And the key thing is that you meet the personal specification. And if it's the essential side of a personal specification, you have to meet all the essential criteria to be shortlisted. The desirable experience, skills and qualifications you may develop whilst you're in the post, and you can talk to the recruitment leads about that. But it is interesting to look at what is available. I've done a few scenarios on the slide. So the first one might be you've got no idea where you want to work at all, or where your career is going to take you. And this was me. When I registered, I failed my nursing finals. It was devastating. And I was the only person in my cohort to register. And in the 1980s, there was a real lack of jobs. So there was only 2 or 3 posts that I could apply for. And I ended up in neurosciences, but I really enjoyed it because I had a fantastic charge nurse who was passionate about neurosciences, who really developed my career, which retained me in that role. And I gained a passion for education. But I had no idea, and you might have no idea, and that's absolutely fine. What may help is to attend informal visits to aid your decision making. And remember that wherever you work as a Band 5, you will develop key transferable skills and knowledge that will aid your career progression. You might even secure a Band 6. You might not necessarily go for a Band 5. It depends on your past life experiences. And I know students that have I know a student that went for a part-time research post that was set at a band 6. She met the personal specification requirements, and the other half of her role was a band 5 staff nurse. And she's now a COVID research nurse as a band 6 or 7. So it's really important on the previous slide to look at what's available and do I meet the criteria for that role. The majority of people, band 5s, will go for newly registered nurses, sorry, will go for band 5 roles, but do look at what opportunities are out there. Have patience. It sometimes takes years to know where your career lies, and everybody's different. So you don't need to have a plan. I didn't. Go with the flow and see where nursing takes you. You may know the general area of nursing that you prefer, but you don't mind where you work. So it could be a whole field in the community, for example. It might be in an acute care service or rehabilitation, but you don't really mind what specific area. So you're flexible, but you should choose an area still that's going to give you the most support and opportunities. So find out as much as you can about the area, the field that you're, a general area of nursing that you're applying for. Do an informal visit, look on the employer intranet, talk to staff in the area, experienced nurses, and ask yourself, can I work with this team? And you can compare your informal visits so that you make the right choice. Are they offering enough support and development? Will they offer the hours? Because sometimes the hours is really important, and flexible working. You might know exactly where you want to work and have a specific area in mind. And the more people that apply, the more competitive that post will be. So if this is your ideal post, you need to plan and prepare for your interview rigorously to give you the best chance for that post. And as I said earlier, have a look at my tips for writing a strong personal statement and how to prepare for a band 5 nursing interview. If you are not offered the role, don't be devastated. It can be devastating. Sorry, I can't speak today. It can be devastating, but get your interview feedback, and there is nothing stopping you applying again. And I know nurses that have done that. They've been in a band 5 role, and then sort of 8-9 months they've gone back to the area saying, this is my ideal role, please consider me for the next band 5, and they've gone for another interview, and they're now been experienced nurses in the area that they initially wanted. So don't give up on your dream for an area. You might know the role you're aiming for and be really ambitious. So this isn't the field, this is the role, because some people know that they want to be, I don't know, a health promotion nurse in mental health, in the community setting. There could be real specific role that they want to go for, linked to education or a specialist nurse role. So establish what future experience, skills and qualifications are required for that role, and then you can align your career choice for your first role accordingly. And I'm doing a video on tips to support career progression in nursing, and it could be a sideways move. It doesn't have to be going up a career ladder potentially. It could be in the same role, same level, but in a different type of role. And it's important to align your academic level and courses with your professional experience, which is really helpful to aid those career choices. Speak to nursing career advisors and people working in the role that you aspire to, and you'll find out that there may be certain areas that would give you better opportunities. If you're going to be, I don't know, a multiple sclerosis specialist nurse, you're probably best to look at a neurology role if you're wanting to aim for that role as quick as possible. If you are ambitious, not everybody is, and that's absolutely fine, but if you are, you can start aligning your career quite early on. Work-life balance, so important. We all have a life out of work, and it's important to think about if you need flexible working due to caring for children or an elderly parent. You might have to have certain hours because of your partner's role. You might need to think about the location and travel to work, your social circumstances and finances. Do you need to be close to wherever your childcare is or schools are? That's really important for some people. And again, that will narrow your choices down, because not everywhere will offer exactly what you want. I mean, hopefully they will, but they might not. So that will help with your decision making. Where to look for jobs: national online recruitment sites, nursing journals, local and national recruitment fairs. You can check employer intranet sites. They might have online staff notice boards, job centres, newspapers, and contact employers directly. Even if a post is not out currently, it may be in the future. So keep connected and be proactive during your degree, and talk to managers, as vacancies are dynamic, so they may fluctuate and change over the coming months. Book an informal visit. The best way to establish whether an area suits your needs is to attend an informal visit. And to make any good decision, you need as much information as possible. And you do take a risk securing your first post without an informal visit, really. You should get a feel for an area when you attend your informal visit. Book an informal visit by contacting the manager or the local recruitment lead by email or telephone to secure an appropriate time. And just be aware that senior nurses are really busy. They may not respond straight away. So sometimes it's a really good tip to email a deputy manager and an educator too. Remember, you can start making those connections whilst you're a student, as a second year or third year, and during your first post if you didn't get your first choice. What to expect during an informal visit. This is usually a talk and a walk around the area to discuss what they can offer you as a new starter. And you can ask as many questions as you want, and you can acquire a massive information that can help your interview, especially if it's a post that you really want. The type of nursing system used. Do they have team leaders? And they may ask a question about team nursing. The service priorities currently. Is there future service improvements planned? And when you go for interview and you say, oh, I really enjoy, if they ask, why do you want this role? You could say that I went on an informal visit and I learned so much and it seems really welcoming. It's going to give you lots of points at interview if you know about the service improvement changes and what's going on in that area, if that's a post that you're really set on securing. And the post-registration education and support offered to you is really important. What to expect. So during an informal visit, also it's really important to gain insights to inform your decision. And my talk on post-registration, nurse education and applying for courses may help you with that as well. So some example questions: what types of conditions, specific needs do the clients have? What are the shifts? Do they use electronic patient records or other digital patient care tools? What key service improvements are being planned? You don't have to ask all these questions. I've just given you some example ones. So pick your own. Do they have clinical educators, an educational structure, education linked nurses? What are post-registration courses and study days are aligned to this area? Who's responsible for supporting my learning and professional development? And the key question all of you need to ask is who will support me if I need some additional support or I'm struggling during that first year? How long will my supernumerary period last? If you go to an ICU, for example, you might get 12 weeks, whereas a ward area might be 2 to 3 weeks, and then they have a structured buddying system. But it's really important to find out what's available. Is there a structured orientation program, preceptorship program? How does it work in that clinical area? How will I be supported when I come off my supernumerary period? And what sort of buddying system is there? Are there band 5 competencies or supportive peer groups? What potential is there for progressing my career in the future? Who would I talk to about my career development? Are there local nursing career advisors? Again, you don't have to ask all these questions, but if you're really ambitious and you want to know what roles are available and career support there is, you might want to ask those questions. What should be offered is a corporate induction and institutional induction, where you might get your security card, and a local orientation. There should be statutory mandatory training, which is essential. You should be allocated a preceptor and you will be the preceptee, but that preceptor may oversee your development and your professional development reviews. You still need to have somebody in the placement area, in your clinical setting, who will support you and that you can go to if you need support. Professional development, so there'll be specialist skills. There might be equipment training, there may be in-house specialist study days in learning disability or mental health, and lots of different conflict resolution courses, lots of different types of courses that will be specific to the area that you're going to. Regular professional development reviews, constructive feedback on your performance in practice is really important for your development. You might need well-being check-ins, you should be offered an annual appraisal, clinical supervision where you have a confidential environment where you can reflect on your practice and discuss issues important to you, and that might be that you're allocated a clinical supervisor, or there's a booking system whenever you need clinical supervision, and different employers offer it in different ways, but it should be offered. Post-registration academic courses that are available to you. Rotation posts, you may want to look into rotation posts, and if you've experienced a narrow range of student placements or are uncertain where to develop your career, they can be helpful, but you need to check that your employer offers them. Not all employers do offer them, and contact managers and recruitment leads for guidance. Think about how they would be set up. Sometimes they are set rotations where there might be 2 or 3 areas where you spend 6 to 12 months in each area. Some employers offer bespoke rotations, but a rotation may not suit all nurses, as you can feel unsettled moving between areas. But others find them invaluable to help them decide which future career pathway would be best for them. So check out my other videos, writing a personal statement for a newly registered nurse post and how to prepare for a Band 5 nursing interview. Hopefully they'll help you if you've not already had your interview. And if you're interested in contacting me, you can ask me questions in the YouTube comments, contact me on my website, on Twitter or Instagram, you can DM me, and I wish you good luck with your first post, wherever it is and wherever your career takes you.